Hey, I've got a question for you. Are you breathing? I know, silly question. Okay, how are you breathing? Seem a little bit confusing? Well, the way that you breathe, your alignment, directly impacts how the pelvic floor is functioning. It can weaken or create a hypertonicity in the muscles. The diaphragm and the pelvic floor work as a team. They need to be in ideal alignment to flow to the best of their ability. So our posture and our breath are so important to the function of our pelvic floor. That is why it's the foundation of what I teach when I'm working with women in pelvic floor exercise rehab. So take a moment to watch this video and learn how I want you to breathe so that you can have an effective, functional pelvic floor. This is a lying core breath. It is one of the movements that we use in a hypopressive routine. In this video, I'm going to show you how to align yourself for simply the breathing portion to help open up the rib cage and to get a more expansive diaphragmatic breath. We're going to start with considering our alignment. I want you to imagine you have three domes: pelvic dome, a mid dome at your diaphragm, and the dome at your top of your head. You want to make sure that these three domes are in alignment. One of the domes that is easy to get out of alignment, especially in lying position, is the head. The way you can check on that is take your hand, run a flat palm of your hand on the top of your head with your fingertips touching the floor, elbow up to the ceiling. You'll know if your head is out of alignment or that top dome is out of alignment based on how that feels. Or you can do this alongside a mirror to help as well. So let's get that top dome in alignment, the center dome in alignment, the bottom dome in the pelvic floor area. Lying with legs flat does help keep the pelvis stay neutral. I want you to now look at your toes or feel your toes, and I want you to turn them towards the ceiling. Active feet. This is active feet. This is passive feet. This is active feet. Feel the difference and make sure those legs are nice in alignment. The femur bone is coming out of the hips in alignment as so. The next thing you're going to do is place your palm of your hands on either side of your rib cage and your fingertips along, feeling for your ribs. So your pinky finger will run down to the bottom of your ribs and the rest of your fingers will line up along the tops of your ribs. We're going to use the sensation of our hand placement to help feel for opening the rib cage. The first thing I want you to do is just to take a breath in and out and notice what happens with your body through that breath. Are you breathing in forcefully into the belly? Are you stuck up in the chest? The goal here is to create a core breath, but to do so with the ribs expanding open and creating space for the diaphragm to contract down into the abdomen. So we're going to use an exhale to line our feet up. So see, mine are in the passive, relaxed state. So I'm going to take that breath in. And as I exhale, I want to line my feet up into the toes up active position. Now take a moment and watch closely as I play around with my ribs and touching gently along with my fingertips and feeling for expansion in the side rib cage. What I'm doing here is I'm not trying to use muscle to expand the rib, but rather breath. And as I'm breathing in, I'm also thinking about keeping my abdominals relaxed, not trying to force them out or use them to pull my ribs apart. All right. So the next thing I want you to do is to think about breathing in through your nose and breathing out through your mouth very gently, like as if you're blowing a feather off of a very light feather off of a surface. I like that analogy. Domes in line, toes active to the ceiling. Breathe in through the nose. Feel the ribs expand gently into the back. And then letting out gently through the mouth. Now, sometimes this brings about so much relaxation in the muscles that it can be a little sore on our back as those tension that's been holding there is lets go. So another position to put your feet in is a slight bend, not too much. Careful that it doesn't tilt your pelvis. So this is where you need to pay attention more to the pelvic dome. It has a potential to go out of alignment with our knees up. Toes are active, legs in line, domes in line to the top. Hands at my side, breathe in through the nose, into the back and side ribs, and then slowly out through the mouth. Notice the very gentle expansion of my ribs. Belly is not pushing out too much. And I'm thinking to myself, into the back, feel that back expansion. Let me show you a bird's eye view of this. But if you are struggling, I'm also going to show you another way to try this breath before you go onto your back, or try it on your back, then try the other movement I'm about to show you, and then back on your back. So before I show you a bird's eye view of my stomach, let me show you the next way to feel for that back expansion of the rib cage that I want you to have. Okay, in this position, I'm just in a child pose position with my legs, knees fairly in line. If you want to roll up a towel and put it under your stomach, you can. Or just drop your head down, place your hands back this way as one option, or gently at the sides of your head as another. I don't want any tension in your body. If you need support under your bum, support under your belly to lift yourself up a little bit, then you can do that as well. So from here, I want you to think about breathing into the back and side rib cage. So inhale into the back, and then exhale through the mouth slowly. Remember, we don't want to force out the belly. Let the abdominals relax as we inhale. So they may feel like they're dropping to the ground. And then slowly out through the mouth. So once you've done a few of these, turn back over onto your back and try the breath on your back again. Here's a bird's eye view of my stomach. I'm going to start by putting my hands on my sides so that you can see how I'm just gently telling my ribs to come apart. My knees are bent. I have my domes in alignment. I'm going to breathe in. And then slowly out. Take some time to release the tension that you're feeling in your abdominals when you inhale. And then gently exhale. Feel the ribs come back together as you exhale. Watch the belly button too as I inhale. Doesn't push up too much. And then as I exhale, it should rise up slightly as the ribs come back together. Here's another thing I'd like you to notice. As I'm inhaling, I'm just relaxing my abdominal muscles. I'm not trying to push my belly out. And as I exhale, I'm imagining I'm maintaining length and space between my hip and my armpit. And that makes the belly draw in and up. So there you go. There is Great technique and cues to use to help get that nice deep diaphragmatic breath we're looking for, expanding through the ribs. This is the foundation of pelvic floor exercise rehab, so give it a try.